Our patient today had multiple previous procedures with not very good results. Very little donor area is available. And as evidence here, we had only 3,800. We need a lot, but our goal is to harvest as much as we can from the donor area and also harvest some from the bearded area. It's definitely going to be a little bit more challenging. And the goal is start from the front, high density zone, mid scalp, and just continue as far back as we can until we run out of grafts. Our patient today is 63 years old male with a long history of hair restoration procedures. So today we are supplementing another 1,400 grafts. So what makes multiple procedures more challenging? Couple aspects here. One is challenging in the donor area and challenges in the recipient area. Every time we have some type of surgical manipulation, either FUE or FUT procedure, it will create scar tissue. The more scar tissue is there, the more difficult to penetrate it with instruments like a punch. Scar tissue is a deposition of connective tissue. It creates bands. There is less vascular supply as a result. And the third challenge is because multiple procedure being done previously, there is a depletion of the donor area. So my goal was to identify those thinning areas in the donor zone and make sure that I don't harvest too much, not to make things worse. And then let's talk about the recipient zone. Same challenges. We have a lot of scar tissue. We have a lot of connective bands and less vascular supply. So definitely we are concerned about graft survival rate because grafts need oxygen. Graft needs blood flow in order to survive right after the transplant. So patient will get into the intensive hyperbaric oxygen therapy here on site. More challenging than usual. It took me longer, but I made sure that I go slowly. I follow every angle and deviation of the each follicular units to minimize transection rate to as little as possible. I think we between 3 to 5% right now, which is very good for the patient who is a veteran with hair restoration procedures.